Namaste, Salam Alaikum, and good evening to one and all. I am Dr. Vinod Gaikwad, First Secretary, Culture, Consular, Education, and Community Affairs. On behalf of Embassy of India, Kuwait, I welcome all of you to today's symposium on combating COVID-19, the India-Kuwait partnership. A very warm welcome to our guest of honor today, Dr. Ahmed Thueni Al-Anezi, the President of Kuwait Medical Association, Dr. Amir Ahmed, President of Indian Doctors Forum, and Dr. Sajna Muhammad, Vice President of Indian Doctors Forum, are also with us today in the auditorium. I welcome all our panelists. A very warm welcome to the media persons who have joined us and all members of the audience, many of who have joined us on the virtual platform as well as on social media platforms of the embassy such as Twitter, Facebook, and YouTube. Ladies and gentlemen, in the beginning of the 2020, we were all presented with a challenge that looked formidable. It was made more difficult because of the lack of right information, transparency, and in general, any know-how about dealing with it. However, as COVID-19 progressed, thankfully, our understanding of the disease itself and the ways of dealing with it also evolved. One thing we have all learned in the last year is that there is only one way of fighting COVID-19, and that is by collective and coordinated action by all of us. The Government of India and the Government of State of Kuwait, working in the spirit of the traditionally close and warm relationship, continue to deepen their partnership in fighting the COVID-19 pandemic. Today's symposium will cover all the synergetic efforts of India and Kuwait together in overcoming the COVID-19 pandemic, the biggest public health challenge in our living memory. The challenge faced by public health specialists while tackling any public health issue is to bring behavioral change in public at large. As a former student of public health, I believe that successful management of any public health issue must be centered on continuous, transparent, evidence-based, as well as adaptive communication with the general public. Hence, today's symposium on COVID-19 is an outreach effort of the embassy to highlight the latest information and efforts of scientific community in combating COVID-19. As we all know, India has and is playing a stellar role as net health security provider for the whole humanity today by showing our solidarity and assistance. India has provided free medicines to more than 150 countries, and now under Mission Vaccine Maitri, India has already shared Made in India vaccines to more than 40 countries across all continents. A consignment of 200,000 doses of Covishield vaccines have reached Kuwait on 1st February 2021. Our esteemed speakers today will deliberate on all these issues and more. We are fortunate to have amongst us today some of the leading medical experts in Kuwait. Well, without further ado, may I now request His Excellency Shri C.B. George, Ambassador of India to Kuwait, to deliver his inaugural address.
Honorable President of Kuwait Medical Association, Dr. Ahmed Al-Naisi, President of Indian Doctors Forum, Dr. Amir Ahmed, Office Bearers of Indian Doctors Forum, senior doctors who are in our panel today, distinguished guests, ladies and gentlemen, good evening to all of you, and welcome to Embassy of India. I begin by conveying my hearty greetings to our friends in Kuwait on the occasion of the 60th anniversary of their National Day and the 30th anniversary of their Liberation Day. We Indians in India and Indian community in Kuwait join them in celebrating this important anniversary. For Indians in Kuwait, it is a special occasion, as this year we also celebrate the 60th anniversary of the establishment of diplomatic relations between our two countries. It is also the 75th anniversary of India's independence. Altogether, a great year of anniversaries to celebrate. Unfortunately, we cannot celebrate it with a lot of festivities, but we propose to celebrate these anniversaries within the parameters of COVID-19 guidelines and protocol set by the Ministry of Health of Kuwait. I thank His Highness Sheikh Nawaf Al Ahmad Al Jaber Al Sabah, Amir of the State of Kuwait, and His Highness Sheikh Mishal Al Ahmad Al Jaber Al Sabah, Crown Prince of the State of Kuwait, for hosting the large Indian community in Kuwait, and for the care and support the government and the people of Kuwait have extended to the Indian community during the COVID-19 pandemic. I acknowledge the presence of Honorable President of Kuwait Medical Association, Dr. Ahmad Al-Enisi, who has joined us today and agreed to address us. I recall my meeting with him at the Kuwaiti Medical Association, where we discussed the ways and means to strengthen our partnership in healthcare. In fact, cooperation in medical sector is a key element of our multifaceted bilateral relationship. I thank him for accepting my invitation and look forward to his address on this important topic, combating COVID-19 India-Kuwait partnership. I also thank Indian Doctors Forum, its president Dr. Amir Ahmad, and senior doctors who have joined us today as panelists and experts. The IDF team is our partners, is always in front of the efforts of the embassy in ensuring the welfare of the Indian community in Kuwait. I thank IDF for its humanitarian efforts and its many endeavors in supporting the Indian community in its efforts to fight the pandemic. Dear friends, these are difficult times for all. The COVID-19 crisis has become a global challenge of a magnitude that humanity has not experienced in recent memory. It is throwing up new challenges to every country, every society, every family, including in India and in Kuwait. I thank our doctors, our nurses, and other medical professionals all over the world who work day in and day out to save lives in our fight against this pandemic. Dear friends, coming to our topic today, combating COVID-19 pandemic, let me quote from the remarks of UN Secretary General Antonio Guterres on January 28 last month, when he said, and I quote, "I would like to say how much we count on India. I mean, India has one of the most advanced pharmaceutical industries. India played a very important role in the production of generics for use that was outside, a very important element of democratization of access to medicines all over the world. And we strongly hope that India will have all the instruments that are necessary to play a major role in making sure that global vaccination campaign becomes possible. I think that the production capacity of India is one of the best assets the world has today, and I hope the world understands that it must be fully used," unquote. Let me again quote from a recent address this week by Foreign Secretary of India, which aptly summarizes India's efforts in combating the pandemic and its engagement with the world in this crucial hour of crisis for the humanity. He said, and I quote, "The COVID pandemic has had far-reaching impact on the geopolitical and geo-economic landscape. It is the greatest shock to the international system since the Second World War. We were also confronted with the most severe economic slowdown in living history. The human cost of the pandemic has been substantial. Lives and livelihoods both have been lost. Every facet of our national life has been affected by complexities and difficulties. Indian diplomacy and our external policies are no exception," unquote. Dear friends, as an Indian diplomat, one is happy to note that India has acted with resolve during this unprecedented crisis. In India, the rate of spread of infections, the number of fatalities, and the number of cases requiring hospitalization and critical care have all shown a consistent decline in recent weeks. It being a large population, 1.3 billion, one-sixth of the total population of the world, the number of cases always appears big. India's recovery rate is over 97% compared to much lower recovery rate across the globe. Active cases is only 2.7%. India's fatality rate is 1.4%, which is much below the world average. When we started the COVID crisis, India was a net importer of many items including masks, PPE test kits, and so on. Today, it has not only become self-sufficient, but is exporting across the globe. It is a success story of Atmanirbhar Bharat. The period of lockdown was effectively used for capacity building. What we followed was an all-India effort involving central government, state governments, and district and village authorities with people's participation. Prime Minister regularly addressed the state governments and the people directly, launching various programs aimed at taking this all-India effort forward. In October, Prime Minister launched a Jan Andolan, that is People's Movement, to ensure cooperative responsibility. I am happy to note that India is doing well in dealing with the pandemic today. At the same time, India also focused on our diaspora and also on our immediate neighbors, extended neighbors, including in the Gulf, friends and partners across the globe. The Vande Bharat mission that India launched returned several million Indians back to their home country. This involved cooperation with many countries, including the state of Kuwait. Look at the scale, the largest operation in the world, which is still continuing. Vasudhaiva Kutumbakam, meaning the world is one family, is central to India's civilizational ethos. Vaccine Maitri, the global health diplomacy operation in which we have supplied vaccines, made in India vaccines, to nations across the world, is a practical demonstration of our belief and our behavior in international relations. We have so far supplied about 230 lakh, that is 23 million doses of vaccines, to friends and partners across the globe. Indian vaccine capacities will generate another 1.1 billion doses for the WHO-led COVAX scheme that distributes them to developing countries across the world. In his address to the UN General Assembly in September last year, Honorable Prime Minister of India, Shri Narendra Modi, had assured the global community that India will use its production and delivery capacity to help all humanity in fighting the virus. This is exactly what we have done. India has extended medical and other assistance to more than 150 countries in the fight against COVID-19 pandemic when the global crisis was severely tested the resilience of other nations. India has sent essential drugs, testing kits, and other medical assistance. India has established its credentials as the pharmacy to the world during the crisis. Medications made in India were shipped to destinations across the world in daunting logistical circumstances imposed by lockdowns. Indian rapid response teams were deployed in 8 countries. Indian naval vessels and Air Force airplanes delivered supplies along a wide arc to friends and partners. It's a matter of great pride to each one of us to see how India has not only developed its own indigenous vaccines, but also supplied made in India vaccines to several countries, including most countries in our neighborhood, extended neighborhood, and in countries as far as Brazil. This is also reflective of the economic and scientific transformation that India witnessed in recent years. It is pertinent to mention that India has announced a gift of 200,000 doses of COVID-19 vaccines to the United Nations peacekeepers across the world. I have seen reports that in addition to Made in India Covishield vaccine, the Made in India Covaxin by Bharat Biotech already covered over 9 million health workers and aims to cover 300 million people by August. India is also in the process of exporting this to various countries. Bharat Biotech has been approached by several countries across the world for the procurement of Covaxin, and supplies are expected to take place shortly to these countries. Dear friends, as Ambassador of India to Kuwait, I am particularly happy to see the excellent cooperation between our two countries in the fight against COVID-19. Our doctors, our nurses, and other medical professionals, through their hard work and sacrifice, brings respect and admiration to our country. In April 2020, Government of India sent to Kuwait a 15-member rapid response team to combat the coronavirus pandemic. 200,000 doses of made in India vaccine Covishield reached Kuwait on February 1. We are exploring ways and means to further strengthen our cooperation and engagement in combating this pandemic. Over the years, India has become an important destination for medical travel from all across the world, including from Kuwait. There are several factors contributing to that: world-class hospitals, finest doctors, medical infrastructure, personalized service, and least expensive. Let me reiterate, India has become a pharmacy of the world. Indian pharma sector supplies over 60% of global demand for various vaccines, over 50% of generic demand in the US, and 25% of all medicine in the UK. India is the largest producer of generic medicine in the world. I look forward to a day in coming months we will have the Indian generic medicine available in Kuwait as well. I once again thank you all for joining us today. I urge all present here to share the link of this day's program to others who could not join us today. We need to reach out the valuable discussions of our panelists and experts on combating COVID-19 pandemic to every Indian and every friends of India in Kuwait. I look forward to a very fruitful discussions today. Once again, I thank you all for coming over. Thank you and good evening.
Thank you very much, sir, for your remarks and introduction to India's efforts as a global first responder in this pandemic. May I request you to kindly remain on the stage while I request our esteemed panelists to join you on the stage. May I now invite our guest of honor, Dr. Ahmed Thuweni Al-Enezi, the President of Kuwait Medical Association, Dr. Ahmed, President of Indian Doctors Forum, and Dr. Sajna Muhammad, Vice President of Indian Doctors Forum, to come on the dais. I would like to take this opportunity to introduce our guest of honor today. Dr. Ahmed Thuweni Al-Enezi studied medicine at the Royal College of Surgeons in Ireland. Currently, he is a consultant rheumatologist with Ministry of Health and a board member of the Kuwait Rheumatology Society. He has served as member of many committees constituted by the government of Kuwait, including as a member of the board of trustee of the Kuwait Institute of Medical Specialties. Since 2018, he is the president of Kuwait Medical Association, which was established in 1963 to be the first professional association in the Gulf Cooperation Council. KMA today includes 16,523 physicians working in the public and private sectors in Kuwait. May I now request Dr. Sajna Muhammad to welcome Dr. Ahmed Thuweni Al-Enezi, President of Kuwait Medical Association, by presenting a flower bouquet to him. Thank you, everyone. May I request our panelists to occupy their respective seats on the dais, please? Moving ahead, may I now invite Dr. Ahmed Thuweni Al-Enezi to deliver his remarks. Over to you, sir.
The Ambassador of India in Kuwait, His Excellency Mr. CB George, the President of Indian Doctors Forum, Dr. Amir Ahmed, our colleagues, health professionals, doctors, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh, and good evening to you all. It really gives me an honor and great pleasure to be with you this evening, participating and supporting a very relevant and important scientific activity, being the symposium combating COVID-19 India-Kuwait relationship, sponsored and organized by the Embassy of India-Kuwait and organized and helped by our colleagues in the IDF. It has been more than a year since the war against COVID-19 pandemic have started all over the globe, affecting more than 111 million people and killing more than 2.5 million people all over the globe as well. A war in which each and every country provide the best efforts to save lives. A war in which medical professionals act as the white army frontliners. And science with medicine and vaccines manufacturing represent our best weapons against this war. And all with the need of the supportive authorities, including economic and political support, to provide the best environment for this army and its weapons. Here in Kuwait, we are very proud that 25% of our population are from India. Besides the strong and ancient India-Kuwait relationship, a country playing a vital role. The ambassador, His Excellency, gave very descriptive words about India. India help to the whole world, not to Kuwait only. In fighting COVID-19 pandemic all over the globe, being the world's second largest manufacturer of personal protective equipment, PPEs, and currently running one of the world's largest factory for vaccine manufacturing, providing Kuwait with 200,000 doses of made in India vaccine, Covishield, and more to come. We're expecting more to come to support the war against COVID in Kuwait as well. And that wouldn't happen given the huge competition to get quality type of vaccines in different countries without having this special Kuwait-India relationship where the Embassy of India, Kuwait, play a vital role. Inside Kuwait, Indian health professionals represent a large portion of the White Army, and that's fighting against coronavirus and pandemic. I myself have witnessed COVID wards full of nurses and doctors from India, helping to save lives of Kuwaiti citizens and all other residents here in Kuwait. And I'm very grateful to them, one by one, and to the organizations supporting them, like the Embassy of India and the IDF as well. I also have witnessed affiliates of IDF being involved voluntarily to screen suspicious corona-infected areas in Kuwait as an attempt to contain the spread of virus in Kuwait. All beside other scientific, public awareness and community-based activities done by IDF and its affiliates to fight corona in Kuwait. Your Excellency, ladies and gentlemen, Kuwait, like many other countries, is passing through a very difficult second wave of the coronavirus pandemic, requiring all the support and cooperation among all to help passing through this difficult time. With no doubt, the activity in hand that we have today is one very important attempt to fight against the pandemic by knowing more about it. By that, let me thank you all and thank the outstanding speakers with us today, thanking IDF for helping in organizing such activity, and of course, the Indian Embassy of Kuwait with its lead by His Excellency, Mr. George, for sponsoring and organizing and supporting this activity. I thank you very much, and I hope you very fruitful and very useful activity as a step to fight against coronavirus. Thank you.
Thank you very much, Dr. Ahmed Veni Al-Inezi, for your insightful remarks. We are indeed very thankful to your fraternity for seeing us through this pandemic. May I now invite Dr. Amir Ahmed, the President of IDF Kuwait, to introduce the theme of the symposium and introduce all our panelists for the symposium today.
Thank you, Dr. Vinod. Honorable Ambassador of India, His Excellency Mr. C.B. George, Honorable President of the Kuwait Medical Association, Dr. Ahmed Al-Inezi, respected officers, officials of the Embassy of India, my friends at the media personals, my colleagues over here who are assembled, the panelists led by Professor Menon, ladies and gentlemen, Assalamu alaikum, good evening, namaskar. We are very much still under the midst of pandemic, COVID pandemic. It's been more than a year and our fight continues. This activity, which has been hosted by the Embassy of India, is yet another step in creating health awareness, which plays a big role towards understanding and containing and helping us control this pandemic. Our Honorable Ambassador just mentioned the wonderful ties that exist between Kuwait and India that has been going on for generations. But there is a special partnership between Kuwait and India during these very trying times. I may be reiterating, re-emphasizing what our Honorable Ambassador has already spoken about, but it is worth doing so. Kuwait led by example. In this region, Kuwait still leads by example. Kuwait was one among the first countries to close its border, to enforce a lockdown, to put emphasis on social distancing, to lay emphasis on the preventive aspect, and at the same time, to be prepared for an eventuality. The biggest danger faced by this epidemic or pandemic is the speed of spread of this disease. Kuwait closed down all its regular healthcare services, state hospitals, state clinics, set up a COVID hospital at Jabar, set up a field hospital at Mishraf, at Mahbula, took all the precaution and without any discrimination between its citizens and residents, offered quality care, both preventive-wise and therapeutic. India-Kuwait partnership started right from beginning. Our ambassador just informed the very first expert committee delegation, the rapid force, came down over here in the very initial period to help Kuwait set up the proper management facility over here. That was the first step. Then Indian Doctors Forum, under the guidance of the Embassy of India, our members, we were 24/7 available to the large Indian community. Not only, it was not restricted to the Indian community. Those who could talk, speak in English or the regional language, they approached us because people were scared. People were afraid. They didn't know what was happening. There was problems due to COVID, but there were much greater problems because of the psychological effects that was being created by COVID. So we were available 24/7, most of our members, to give counseling, to give them, reassure them. This is one part. The other part is, along with the public health, Ministry of Public Health, Honorable President of KMA just mentioned, our doctors played a big role in contact tracing, which was very important to limit the spread of infection. Remember, we were not aware this virus is a novel virus, and we did not have an idea how it would act. So, it's a supreme sacrifice made by the members of IDF during that time. I'm extremely grateful to each and every member of IDF who stepped out and did this. So again, there, India-Kuwait partnership to help contain the The role of Indian doctors, the role of the Indian nurses, the role of the other Indian medical personnel has already been mentioned by the President of KMA and also by Honorable Ambassador. Again, a partnership to combat and fight COVID. Finally, now when vaccination is going on and things are not turning out the way it should have for the multinational companies, the leading vaccine manufacturers, not able to keep up to their words, that is when the world over is looking towards India. And India, in true culture, keeping our true cultural thing, we decided that whatever we produce, the government of India must be highly commended. If not for a strong leadership, people had written us off. When the pandemic started off, there was news that probably 700 million people would be affected in India. India would be wiped out. We had a strong leader, a strong government. They took strong steps, closed down the border, enforced lockdown. And more importantly, you had a time when developing countries like Italy and France could not bear their public health system could not bear the number of cases, and you had people dropping down dead on the road. The strong leadership of India had foreseen this and even thought of, our network, railway network is the largest network. In an eventuality, if the situation so rose, we would convert our railway carriages into makeshift hospital and still cater to all those who needed help. So all these steps were foreseen, taken care of, and prepared. But by grace of God Almighty, we never reached that stage. Alhamdulillah. Vaccine, definitely, as alluded, we have Covishield is there. Serum Institute of Pune is producing this vaccine. And Serum Institute of Pune, as our ambassador just mentioned, supplies more than 50% of the WHO immunization program vaccine. So also Bharat Biotech, which is a 100% indigenous vaccine, which is coming out from India. And very shortly, it's still in the third phase of trial. It will be approved by the other international regulatory bodies, and we will be supplying that too. To talk to you more about the vaccine, to talk to you more about the COVID situation, we are indeed today blessed with a panel of experts. And this panel of experts is led, moderated, and chaired by Professor P.S.N. Menon. Professor P.S.N. Menon is a consultant pediatrician. He's the head of the department at Armed Force Hospital. He's an authority when it comes to pediatric endocrinology, an author of many textbooks, a member of the editorial board of prestigious journals. He was the deputy director of the prestigious All India Institute of Medical Science Institute. One of his famous student is the present chief scientist at WHO, Professor Soumya Swaminathan. So we are indeed very blessed, very honored that Professor Menon is a member of IDF, a very senior person, and he is going to be chairing and coordinating the session. Along with Professor Menon, we are today joined in the panel by Dr. Arjit. Dr. Arjit Chattopadhyay is DM Endocrinology, a consultant endocrinologist with the Ministry of Health, and he works for Sabha Hospital. We have Dr. Rohit. Dr. Rohit is a senior specialist, anesthetist. In charge, he works for Sabha Hospital, and during the COVID pandemic, he was in charge of the ICU. Then we have Dr. Saroj Grover. She is a senior physician working at the Infectious Disease Hospital with 30 plus years of experience over there. And finally, we have the youngest member in our panel, Dr. Manu Kurian, a pulmonologist, a frontline worker. He's attached to Jabar Hospital and one whom we look forward to. So this is the panel, and the chief panel led by the moderator, Professor P.S.N. Menon, to control the activities. With these very few words, before I sign off, I would like to request all of you to remember 4 things. Please go ahead, take the vaccine. Don't trust these WhatsApp sites. If at all, WhatsApp sites are not the sites that have to be looked into. If at all you want any information regarding prevention, regarding anything, please trust the Ministry of Health official sites. So go ahead, take the vaccine. That's very important. Before and after vaccination, practice social distance. Wear the mask all the time and wash your hands. These are the golden rules. Whether you're vaccinated, not vaccinated, you have to follow day in and day out. With these very few words, I thank, on behalf of the Indian Doctors Forum, our Honorable Ambassador, His Excellency Mr. C.B. George, and the officials of Embassy of India for having given IDF an opportunity to come over here and participate in this symposium. Thank you. Professor Menon, the floor is yours.
Thank you, Dr. Amir Ahmed, President, Indian Doctors Forum. We are extremely indebted to the Honorable Ambassador of India and the Indian Embassy of Kuwait, and we are graced by the presence of the President of the Kuwait Medical Association, Dr. Ahmed El-Nazi, and we are thankful to all the members of the Indian Doctors Forum who are helping us to prepare the panel of questions by their interaction with the community, not only among the doctors, but also the medical professionals and the public. And we have a set of questions. We have a distinguished panel of experts who are willing to answer these questions to the best of their knowledge. I have some comments before we start the panels. We are, as far as possible, giving you the best advice as prescribed by the Health Department of Kuwait. In controversial situation where such criteria do not exist, we follow the advice provided by the World Health Organization. We are limiting ourselves to the standard format of questions, and without taking much time, I would not like to tell you about the overall situation of COVID or its second wave that is going on in Kuwait. Without wasting much time, I would directly go into the panel of questions. At the moment, actually, we are now seeing the first year of declaration of the pandemic is going to end on 11th of March. We are still working hard to prevent the disease, contain the disease, and reduce the mortality. Despite all advances, we still see that the 3 pillars of management of COVID-19 disease is the same. Please use hand hygiene, wash your hands. Please use mask when you are in public place, and maintain social and physical distancing. These 3 pillars are still maintained the main practice of management despite all the advances in lab diagnosis, medical management, and prescription of vaccines. So let us ensure these principles are followed before we embark on more advances in the management. We will start the panel by asking the primary questions we have received. We have a distinguished panel of physicians who have the ability and had the chance to work with COVID wards in Kuwait, in Jaber Hospital, as well as in their own designated hospitals. So we are lucky that they have their own personal experience to contribute to the answers that they are giving. So we'll start with a few general remarks about the questions. The first few questions are addressed to my colleague, Dr. Arijit Chattopadhyay, who is a consultant endocrinologist in the Department of Medicine at Al Sabah Hospital. Dr. Arijit, the world is still reeling under the influence of COVID-19 pandemic, with cases being reported from everywhere. Everybody is asking, how long will this pandemic continue? Have you got any guess?
I guess that this is the question which is there in everybody's mind since the beginning of this outbreak. But we need to understand the dynamic of COVID pandemic. The year 2020, COVID undoubtedly had a devastating and profound effect globally. We were not knowing the terms like lockdown, quarantine, but we were familiar with these terms. And there was a new form of normalcy started, like wearing mask in the public places when we are going out, washing our hands. So it's really a terrible situation, both in terms of the disease and its economic and social impact. The year 2020 ended with a happy note of rolling out of vaccines. And we all were expecting that we will surely win over this crisis. Now we need to understand that COVID virus, it's an RNA virus, and like many RNA virus, it has a tendency to modify its nature and behavior, which we medically called as mutation. And unfortunately, some variation of this virus being reported from areas like UK, South Africa, and Brazil, which found to be more spreading rapidly, although the nature and behavior of the disease did not change. So what we presume as of now, that we all need to have a very organized vaccination strategy to cover a large amount of population, because we understand at present that these vaccines are likely to reduce the morbidity both in the classic form and the variations of COVID-19. Thank you.
Thank you, Arijit. You already mentioned two words which are misunderstood by the general public. One is, what is quarantine? What is isolation? Do you mean the same? And if these are not the same, what is the current protocol for the public as far as these terms are concerned?
Yeah, actually, we are quite familiar nowadays this so-called medical term called quarantine and isolation. Actually, in COVID-19, quarantine is a term which is used mostly for the travelers who are returning to a country and possibly been exposed to a positive case of COVID. And in this situation, the person, we don't know whether the person is going to have the disease in future. That means the person may be incubating the disease, not manifesting the disease, and we need to isolate the individual at home or an institute for a particular period of time to observe that the person did not develop the disease. While talking about isolation, I am referring to a person who is actually found to be positive for COVID or having symptoms of COVID. For example, if some family member who is found to be positive and the other family members are also having some symptoms, irrespective of their status of test positivity, they should isolate themselves. The current protocol in Kuwait is that a person needs to be in institutional quarantine, particularly the returning passengers, for 14 days. Institutional quarantine means that they should not stay at home, they should stay in a hotel which has got quarantine facility. For isolation, what we generally recommend is again 14 days, or we consider that the patient is possibly free to transmit the disease if they are asymptomatic, afebrile for a sufficient period of time. In this regard, in Kuwait, there is an online application called Slorec app, and a person who is on quarantine or isolation needs to register in this app, and generally they need to follow the guidelines as per Ministry of Health, State of Kuwait.
Thank you, Arjit. But the problem with usage of these terms is that many people consider that you are sick only if you have symptoms. So, what is meant by the so-called asymptomatic COVID infection, and if you have asymptomatic COVID infection, can you still spread the disease?
Yeah, just let me explain a little bit that in COVID, it doesn't mean that all people will land up in the hospital or needs hospitalization and treatment. Actually, 3/4 of the patient, like 75 to 80% of the patient, the symptoms could be something like a prolonged viral flu. So, they will be mild symptomatic and they need to isolate. And it is also found that some people may have non-specific symptoms or may not have symptoms at all except some aches and pains in the body, which they may think that maybe it is because of the exertion of the work and all. And these patients are also infectious, they can transmit the disease. So, it is to be careful that if somebody has symptoms or any household member is also found to be positive, the family needs to isolate themselves to restrict or contain the spread of the disease to others in the community.
Thank you. But the other problem is that if you have a patient can spread the disease even if you do not have symptoms or even if the symptoms disappear.
Okay, now, since I worked right from the beginning of this pandemic in my hospital, in Sabah Hospital, and I was working as a consultant in the COVID treating team. And let me share that we used to do something called exit swab. That means that after the patient stayed for a sufficient period of time, we used to do their test PCR to find out whether the patient is still positive or negative. But now we don't recommend, and also it's not required, because it is found that approximately after 2 weeks, the virus loses its infectivity. So, even if somebody is having the RNA or so-called the viral segment in the body, it's non-infectious. So, this means that if a patient has recovered from the disease, very unlikely that the person is likely to spread the disease.
So, the next question will come is that you had infection, you have become asymptomatic with treatment or without treatment. Does it confer any long-term immunity for the patient, that once I had infection, I have become okay, now I am free, I am immune to the disease. Is that a correct term?
Yeah, this is very important for all of us to understand, because many patients came and asked me, doctor, I had COVID, do I need a vaccine in future? What has been found that person who suffered from COVID disease, they will have some immunity developed in their body, which is likely to be detectable and sufficient to protect the individual for approximately 3 months or 12 weeks or so. But it's found that beyond that point, the immune status may come down sufficiently and the patient may be susceptible to the disease or the mutation of the disease. And I would like to stress here, that's why, that even if an individual suffered from the disease, should also require vaccination, and possibly a person who suffered from COVID, they are required to vaccinate after an interval of 3 months or 90 days.
Thanks for clarifying that point. I think there is a bit of misconception that after getting the infection, probably you do not need vaccine. We will come back to that point again when we are discussing vaccines. Next set of questions are addressed to my younger colleague, Dr. Manu Kurian Baby. Dr. Manu is working as a pulmonologist in the Department of Respiratory Medicine at the Jaber Ali Sabah Hospital, which is the pioneering center for management of COVID in the country. Dr. Manu, when does a person diagnosed for COVID with mild symptoms need to be hospitalized? Do everybody has to go to a hospital?
Okay. Now, when you talk about a patient who has mild symptoms, that means that person's saturation, that is oxygen level, checked by a pulse oximeter, is more than 90%, or there is no viral pneumonia depicted on an X-ray.
Yes.
So these kind of patients don't need any hospitalization. Now, when they need to go to a hospital is if there is any increase in difficulty in breathing, or when they check their oxygen levels at home, provided they have a pulse oximeter, and that shows a reading of less than 90%, yes, it is better they go to the hospital. Now, usually when such patients come to us, we see each patient. So it is dealt as a case-to-case basis, because there are many patients who have simple, like sir was iterating that, we can have COVID with very mild symptoms. And most of the time it's just, you just need your antipyretics or analgesics with a good amount of hydration and nutrition, and it's taken care of.
Yes.
So when you have mild disease, mild symptoms, you can take care of at home. The primary thing to do at that time is home isolation. Washing your hands, keeping yourself clean. Then if your saturation is good, your oxygen, your breathing is comfortable, there's nothing to worry. If any of this thing is having any mishap, you should come to the hospital for hospitalization.
Thanks for clarifying that, Manu. The next problem is that the state of Kuwait has got a very significant population who has got respiratory diseases.
Yes,
for example, bronchial asthma. And if a person with bronchial asthma develops COVID-19 infections, and even if it is mild symptoms, does these persons need to be cared for much more carefully? And what about the use of, if they are already on preventive inhalational corticosteroids, what advice would you give to them?
So from the beginning of COVID last year, when things started to pick up, the number of patients and number of people becoming sick started to pick up, this is something that I've been asked regularly. So according to major guidelines that treat COPD or asthma, that is a major airway disease, it has been said that if you're already on inhalational corticosteroids, you continue the same dose as such.
Yes.
There is no changes you need. Now, there are a lot of people who ask, okay, because I'm asthmatic, that means I have lung issues, so that means am I more prone for COVID? There are no studies that have said, yes, these people are more prone. But there are studies that say that who use inhalational corticosteroids such as budesonide or cyclosonide, they going into the serious level of sickness is less. But again, when I say this, I don't mean that so everybody goes and uses a budesonide. No, it doesn't work like that, because every single drug has its own side effects. So when you use any drug, you have to be very careful. It has to be under a supervision. So in asthmatics, yes, there is nothing to prove that you are more prone for getting the infection or you're more prone for becoming sick, but you have to continue your inhalational corticosteroids. Now, when I say this, I'd like to also talk about the people who use their nebulizers. Now, if a person using nebulizer is at home and he's only one positive, I would suggest they don't use the nebulizer at home in front of the other people, because nebulizers will cause aerosolization. That means it can spread the disease within the house.
Yes.
And so the people who are within the house,
Yes.
who don't have the disease or who haven't caught up the illness as yet, it's unnecessary to put them at the risk.
Yes.
Now, when I say this, I'd like to say something that I wanted to say for the last question, that the use of antibiotics in mild diseases is not at all required.
Yes.
So I'd like to urge and make understand people that, antibiotics, this is a viral disease, and antibiotics don't play a role unless warranted by a doctor for for different situation. But right now, for a mild disease, it plays no role to start off an antibiotic as such.
Thanks for clarifying that points about inhalational steroids, use of nebulizers. I think these are misconceptions many have, and probably ensuring that they are appropriately used and there is no need to change management in this. What about smokers? This is a relatively large community of smokers. They also have a, yeah. So what is your advice to them?
So there are a set of people like, within family and friends, there are the ones who are admitted to the hospital and the ones who are getting discharged. They always ask this question, is it okay, can I go back and start smoking? So see, smoking, every single cigarette that you smoke, this is something I read somewhere, that after your skin, probably the organ that is in contact with the environment in large is your lung, because with every single breath it's in contact with the environment. Every single thing you breathe, it goes to your lung. But now, when I say that, of course, there are many levels of filtration that happens before it reaches the lung. Now, when you smoke a cigarette, with every single cigarette, you cut off that protection for nearly 2 hours. So think of that when you smoke. Now, that is one thing. Second thing about smoking, again, you can lead to COPD and you'll have to be on inhalational corticosteroids, which itself can has its own side effects. Third thing I'd like to talk about smoking is that, every time you need to take a smoke, you have to pull your mask down.
Yes.
So again, you're going to do it out in public,
Yes.
giving it out. And then there's something called a smoker's cough, which is predominantly dry, like the COVID cough, which is going to be dry. So usually people tend to think, he's a smoker, so he has his cough like always. So that is one thing. And at this point, I'd like to also iterate again, wash your hands, social distancing, mask is the priority for us right now.
The style is changing. What about vaping?
The vaping is I think they say that it's the same thing. It's the same thing. Its only thing is you have no tobacco in it, and you're going to cause the same set of situations for the patient, and it's not going to make much of a difference.
You mentioned in the beginning that inhalational corticosteroids, which are used as a preventive strategy for existing patients, they would benefit by continuing the treatment. The question always comes, are steroids themselves helpful in the management of COVID-19 infection? Is there any role for them?
Okay. Now to say that, sir, when COVID initially started, no one was using steroid because they compared the coronavirus to what happened in MERS.
Yes.
And the studies had said that time, back in 2012-13, that steroids actually were not beneficial for corona sort of virus. Now, I'd like to state an example, like, you get your finger jammed between a door or you bang your head on the wall, there's going to be an immediate swelling. This is because of the fluid coming out. Similarly, and the inflammation that happens basically.
Yes.
So if you see any COVID, what happens is virus comes into the lung, it causes irritation there, and then your WBCs and all your protective mechanisms start coming in. But for some people, they take care of the virus and that's handled there. But in some people, there's an overdrive. The overdrive kicks in, and then there's a complete array of all these inflammatory markers that come in large, and that's what now everybody knows as cytokine storm. And this cytokine storm is the reason that many people have fluid sort of in the alveoli, which does not allow oxygenation to happen very well, and this causes the people to die. It's not the virus per se, but our immune mechanism that gets triggered in large that causes all these issues. Now, when I say that, about your questions, steroids, one of the major potent anti-inflammatory action, and now that helps in. Now, when I say that, the question arises, then why can't we start for all COVID patients steroids?
Yes.
So the problem is not in all people this inflammatory levels go into too much that they need a medication or a treatment.
Yes.
Our body can handle it. Our body can send its arsenal and take care of the things. We should give its time. Now, a patient who once the recovery trial, the most famous one that came out, once it came out, that's when it was found out how steroids have a role in treating COVID, but they specifically said it is only and only for patients who are on oxygen, who were requiring oxygen in the ventilator, in those patients, it helped reduce mortality and not anybody else.
Thank you, Manu, for very clearly highlighting
Thank
the
you, sir.
specific role for the use of steroids in the management of COVID-19 infections. Let me now introduce the third panelist. The third panelist is Dr. Rohit Rohani, who is a senior specialist in anesthesia and also has been in charge of the critical care as a frontline worker in the beginning of the COVID infection scene in Kuwait. Dr. Rohit, many people are asking about this question about happy hypoxia due to COVID-19. What is happy hypoxia? Can you just explain it? Is it happy situation? Is it alarming situation?
First of all, thank you for having me. Hypoxia as such is a decreased level of oxygen in the blood, which is commonly measured by pulse oximetry, which is the saturation, which is normally for a person 97 to 99%, can go up to 100. The problem is the patients who usually come to ICU with respiratory diseases, they present with low saturation in oxygen. But they usually manifest or tackle that with the increase in respiratory rate, or they show increase in carbon dioxide levels, etc., or decrease in the pH of the blood. But what was seen in, and we had never seen it before, that these patients with respiratory involvement in COVID, they used to come with saturations so low and not showing any signs of distress. So it was like a situation of a patient is almost happy that he's hypoxic. So we had patients with saturation as low as 40% who were sitting comfortably in the bed and showing no signs of distress or illness of any sort, which was very alarming for us. That's why it was termed as happy hypoxia. But the problem for the ICU doctor was when to go or escalate the treatment. I mean, when to go for an invasive kind of treatment, for example, intubation or putting the patient on ventilator. So that was the main challenge which came. So it's actually not good or happy, but that was a problem.
Yeah. It is actually a challenging situation. But this question definitely comes from what Dr. Manu and you are saying. Should everybody who has got a COVID infection should be checking their oxygen saturation by a pulse oximeter? What is your advice?
To be very honest, everybody who called me personally, including my parents who got COVID in India, we were suggesting that to measure to get a pulse oximeter from either a pharmacy or borrow it from somebody for at least a few number of days after you get the infection to measure the saturations because of this happy hypoxia. Because you never come to know that your oxygen saturation levels are falling, and either if it goes both ways. Either you recover from it and you don't go beyond a level of maybe 80s, but once you start dropping rapidly below 80, and it happens within hours sometime. So that's why, honestly, we suggested everybody who called up regarding getting a COVID infection to buy a pulse ox and to measure the pulse oximetry at home. So only oxygen saturation would let you know that your lung is getting involved, and breathlessness or rapid rate of breathing or anything doesn't manifest. So that was the reason.
The problem with the use of all these technologies is that patients come alarmingly concerned about situation, and then many of them think that they need to go into an intensive care unit for further management of the situation. What are the current recommendations actually at the moment for getting a patient into ICU? We now see that most hospitals are increasing the number of beds, ICU beds in every hospital, whether in the government sector or in private sector, not only in Kuwait, everywhere they are increasing. What should be your suggestion or recommendation for the admission to admit patients into an ICU care?
Okay, so ICU admission, there are many criteria. We don't admit patients directly from the casualty unless the patient is really sick. But for example, I was working with Dr. Arijit, so we are in contact with the physicians.
Yes.
They usually admit the patients when the oxygen requirement of the patient keeps getting higher. I just want to like to tell you this one also, that the criteria, etc., they changed with the evolving phase of the pandemic.
Yes.
When the pandemic started, we were admitting patients who required oxygen more than 5 liters per minute. Then we realized that the numbers are so great that physicians had to manage a few patients with the high 10 or 15 liters of oxygen in the wards. But if the oxygen requirement goes beyond the mask, we go to the high flow nasal cannula or the BiPAPs or invasive ventilation. That is the criteria. Again, COVID not only affects the respiratory system, we have admitted patients with pretty normal lung and kidney involvement. It involves the kidney first. Or the patients came with stroke. Patients came with stroke, evolved into bleeding. That is hemorrhagic transformation. So we had such kinds of patients, and obviously if multi-organ involvement, more than one, that was the criteria for admission. And the basic requirement was a very high requirement of oxygen.
Thank you. In general, what is the average stay of patients in an ICU? Of course, it will change depending upon the severity of the infection, other comorbid conditions. But a standard patient without any comorbid disease but has a severe form of disease, usual stay is how many days?
See, on my personal experience, and I think it is been experienced by everybody over the world, the more acute the disease, and
yes.
The patients who tend to give a slight decrease in requirement of oxygen, they, for example, if a patient is intubated and is extubated within a week, he has more chances of getting out. You cannot define as a patient who's gone into severity will stay for this long. Some patients had lung damage which landed them into ICU for 2 months,
Yes.
landed with tracheostomy. So the only criteria is, as soon the oxygen requirements decrease
Yes.
for a patient, the better for the patient. So it may range from a week to few weeks.
Dr. Manu, most of the patients, if the patient is cured of COVID symptoms, does it mean he has completely recovered? It is partially answered by Dr. Arjit in the beginning. How long does the post-COVID symptoms last?
Actually speaking, there are now they are classifying post-COVID syndrome into many things, and when they look into that, like over a year's analysis, they say that the most common thing that patients who have finished their COVID and come out, they report as the fatigue. It is that is the most common thing. Then they have, some people have shortness of breath, some have chest pain, some have cough. Then in a pulmonologist point of view, we follow our patients every 45 days to 60 days once. So one thing that we keep seeing is, lungs being damaged and then it recovering on its own. Yes. There are many people who say, we can go for oral steroids at this point and fasten the recovery of that.
Yes.
But we haven't used, only for very selective patients we have found out, okay, these patients may improve with steroids, and we have used. Otherwise we have solely kept to the guidelines we're following without any steroids. We're giving them exercise. Another major thing that we have seen is depression among these people who have come out of, especially who were hospitalized in the ICU and intensive care. When they come out and they're still in the ward, they're really depressed for so many days. They are isolated inside a closed chamber of an ICU. These things have to be handled even more aggressively.
Yeah, that speaks for the need for helplines.
Yes.
Not only for just providing assistance to entry into hospitals, but also for looking at the overall mental health of the persons who have been affected with COVID disease. Thank you, Dr. Manu.
Thank you, sir.
But the symptomatology and the morbidity of the COVID infection has changed rapidly in the last 3 months. We hear about now mutant strains, variants, and other varieties of COVID-19 coming first from UK, then from South Africa and Brazil. Dr. Arjit, can you just tell us what is happening and how do we know they are, that the cases that we see are just the old garden variety of COVID-19, or is it a mutant strain?
I Actually, right from the start, COVID-19 is posing a huge challenge to all of us, to the healthcare workers, to the scientific community, and to a large extent globally to the general people. The modification or mutated strains which has been first reported in UK, followed by strains in South Africa and Brazil, these are areas of active research to know the behavior of this disease and whether it varies in terms of symptomatology from the classic variety of COVID-19, which has been affecting the whole 2020 all over the world. What has been known at present is that all these variations, they don't differ in terms of severity or hospital-related mortality. What has been found, particularly the UK strain and also the strain from South Africa, that they are possibly more successful in spreading from an individual to another individual. And one of the recent study which I found maybe last week, it says it's like 75% more successful to spread in the community. So unfortunately, it is likely possibility that more number of vulnerable people are going to be affected by these new mutations. And here comes the importance of awareness following those 3 pillars which has been very aptly highlighted by you, sir, to the community till we vaccinate everybody.
That's an interesting observation. We were actually worried that when new and new mutant strains come, the disease become more virulent, more dangerous, probably with high morbidity. But it is reassuring that it is only spreading rapidly, but not affecting more severely the organs concerned. So next comes to the question is, what is the best diagnostic test for COVID-19? And can it also detect the variant or the mutant one?
Yeah, the answer is quite simple, and we all know that we do a test called PCR. PCR is a simplification of polymerase chain reaction. It's nothing but identification of the genetic code, like when we run a CD in the tape recorder like that this genetic code is multiplied with some technique, and finally it is identified. The importance here that PCR technique is labor intensive, means the lab technician who is performing the test has to be an efficient one, and it generally take to run the cycle about 4 to 6 hours. And what I have found is that the conventional PCR, RT-PCR, is also able to identify the mutated strain. At least currently the conventional PCR which we are applying, the mutated strains are not able to escape the detection.
Okay. That is reassuring. But what is more concerning is that can it be false negative?
Yeah, this is an important question, and in fact, we know that sometimes even hospitalized patient who underwent a PCR, one PCR became negative and then later on it was found to be positive. And there could be several explanations, mainly a technique which has to be a perfect one, and also the transportation of the sample from the collection or the clinic to the laboratory. That should be within 4 hours, because these RNAs are very labile, heat labile. They tend to break if there is an undue delay in processing the sample. So there could be false negative.
The other question is, I am tested positive, I am not symptomatic. Can I spread the disease?
Yeah, I actually answered this question even before, that
Yes.
someone who is tested COVID positive, he has to isolate himself even if he doesn't show any symptoms. And even for our people like healthcare workers, nurses and doctors, like Dr. Grover sir is there, in OT, suppose accidentally a patient is found to be positive, it become important for all those people who were surrounding the patient to isolate themselves, and if they have symptoms, they should also undergo testing for the containment of the spread of the disease.
The other question is that if you are tested, if you are positive for corona, whereas we suggested that the family members should isolate. The other question is, should all family members of a person with a positive test should undergo a test?
Yeah, this is a very important question, and many times we hear from our patients and colleagues that my husband or my father or a close family member who is actually sharing the same accommodation is found to be positive. So should I also undergo the test? The current conventional guideline says no, there is no need to undergo the test, but they must isolate themselves. If they are mildly symptomatic or if they are becoming more symptomatic, then they should undergo the test. So we don't actually recommend testing for an asymptomatic family member where one member of the family has been found to be positive. But some situation we recommend testing. For example, if there was a gathering, close gathering, where there were people not wearing mask and somebody found to be positive because there could be some kind of explosion of cases due to negligence. So in those situations, possibly a COVID testing could be done. And nowadays in many of the hospital, before hospitalizing a patient for medicine ward or surgery ward or any ward, conventionally a COVID testing is performed. This is as a precautionary measure to prevent the spread of the disease. And sometimes we healthcare workers, if we are exposed to a patient, sometimes we may have to undergo a COVID test to make sure that we are safe and we can practice our duty.
Thank you for that, informing that. One of the problem with the current COVID testing is that it takes time. It at least takes 6 hours to get a report in the fastest way.
Right.
Are there any rapid test which can give you the answers, some serological test that can give you answers within minutes?
No, actually, I remember when the pandemic started, and at that time, one of the first guidelines the government of Kuwait put is that to take the patients who went abroad for treatment and they were returning. This was the first batch of patients when the flights were closed. And the government brought rapid serology kit. And the same rapid serology kit was also used to screen patients in our hospitals. Unfortunately, they are very unreliable. I don't know why, but we were getting some patient positive with no symptoms, some patients with symptoms negative. So it was pretty confusing, so it was not used. There are certain other tests can be used like antigen test, which has got a short turnaround time, but again, they are not of much use. So we stick to the gold standard of diagnosing COVID-19 with the help of PCR.
Thanks for clarifying that, Arijit. Next set of questions are on the vital or the burning topic of the day about vaccines. To answer these questions, now I invite Dr. Saroj Bala Grover, who is our vaccine specialist for the IDF. She is a senior physician at the Department of Medicine at Infectious Disease Hospital of Kuwait. Let us have a rapid fire session, probably. Yes.
There are too many questions, huh?
Yes, yes.
Sir.
Yeah. Dr. Saroj, why should I get vaccinated if COVID-19 infection, as we all heard, has a 97 to 99% survival rate? It is.
Right. This is, this is for the vaccine hesitant people, we call them, and it's not an easy task. You see, surviving and thriving is different.
Yes.
You can survive, but at the same time, you could have a lot of problems as well with COVID. Let me explain. So, having said that, we have 3 options. Option number 1 is get the vaccine, right? Option number 2 is face the COVID. Now, COVID, we know, as Dr. Manu mentioned, it has a lot of long-term sequelae. It can affect many organs. It can affect the lungs, meaning, it can cause fibrosis, there could be pneumonia. It can affect the heart, it can cause, heart failure and other heart problems. Worse, it can affect the nervous system, meaning somebody can have, convulsions, they can have paralysis, they can have Guillain-Barré syndrome, and now it is being associated with dementia and Alzheimer also. It can affect your kidneys. So the kidneys may be malfunctioning for a little while, but it can be as bad as, requiring dialysis. So you want to face all that. Now, the number 3 would be, staying in a bubble. All right? So I don't want vaccine. So I stay in a bubble all the time afraid, wearing a mask, social distancing, not meeting people, getting scared of COVID. That's option 3. Then we have, I would say, we have to do something for the community. If all of us get vaccinated, we will end up, inshallah, herd immunity. Now, what is herd immunity? This is indirect protection, of the people. Let us say, if 70% of the people, get antibodies, this could be through vaccination or maybe it could be through getting a disease. They will protect the other 30% people. Now, I don't mean to say that, they will not get infection. They may get infection, but at the same time, they may get very mild infection. So this is our aim. I call it, taming of the virus. जैसे हिंदी में कहें तो सुधर जाओ, please. Behave like a normal flu virus, with mild symptoms. We don't want all the complications that, Dr. Manu talked about, that I talked about. So in my mind, I would say, vaccination is the beginning of a pandemic. That would be the right way to describe it. And I think, let us all get vaccinated and play our roles in stopping the pandemic.
Yeah. Let us be examples let doctors and medical professionals be the examples to the general community by accepting vaccination.
We did. I think
but there are still vaccine hesitant people. One of the things that we say is side effects. So what are these adverse events that can happen with vaccination? What you should be worried about?
You are absolutely right, Dr. Menon. This is, the side effects probably are one reason why people don't want to get vaccinated. But I can ask you a question and ask everybody a question. Is everything safe? Panadol is not safe, right? So why, think about the vaccine? For that matter, I think even walking on the street is not safe. One can, meet with an accident and die, okay? Having said that, then, the side effects of vaccine are, mild. So there could be, local side effect. I'll call them effect, not adverse events. People get frightened with that one. So the local side effect would be, some swelling at the site of injection, some pain, some redness. The systemic effects would be a person could have fever, arthralgia, pain in the joint, maybe some vomiting, some headache, maybe some diarrhea. But, the real event which people are scared about is anaphylaxis. It is a very, very rare event. So, but the two side effects that I want to sort of share with everybody, which is coming, as days are going by. See, the side effect which I mentioned before, they are mild. These usually happen after a second dose, and maybe, more so in the young people because they have robust immunity. So, nothing to be frightened of. So, as I said, two side effects that I wanted to mention was, one is what we call as the COVID arm. Yes. Now, we saw in Kuwait also. This was described with the Moderna vaccine. Now, having said that, please, I just want to mention one thing. When I say vaccine, I'm only talking about the vaccine which we are using in Kuwait, and that is Pfizer and AstraZeneca. We are not using even Moderna here. So these are the vaccine being used, and whenever I say vaccine, I mean these two vaccines. Okay, so this is what is called as the COVID arm, and people got scared because this is the delayed hypersensitivity reaction. It doesn't happen usually. The other side effects, they happen within, you can say within 2 or 3 days. And so this happens about 4 to 5 days later, maybe 1 week later, and there is an area of redness, maybe in duration. Now this area of redness may be as big as 6 inches, and people, when they look at it, they get scared. Nothing to get scared about. It will just go away in 4 to 5 days by local treatment. And the suggestion we give is, next time when you take vaccine, don't take it on the same arm, take it on the other arm. Now, another, adverse event or side effect that people got worried about is especially in female. So, the arm where they got the injection, the axillary lymph node got enlarged. So they started to think, oh my God, so if the axillary lymph nodes are enlarged, so this is, malignancy. So and this is due to vaccine. It is not that. Unless the person is having symptoms which are suggestive of cancer breast, like, some change in the breast or, discharge from the nipple, no need to screen these people, for malignancy. That's what they have been doing outside, sudden test, ultrasound, no, not required. Wait for 1 month, it will go away. So now again, the side effects are, not that much. I would say that, if somebody dies in an air crash, do we stop, flying by air? We don't. So if we get mild symptoms due to vaccine, should we be scared to take the vaccine?
Yes.
We should be.
So I think in general you would say that we should try to educate as much as possible the so-called vaccine hesitant people, tell them that reactions are mild and don't spread the word that it is creating problems.
Yeah, they get headache and then think, my God, I should not be taking it.
We have to actually positively encourage a change in the behavior of the people.
I hope we succeed, Dr. Menon, today.
Yes, we are succeeding. That is the vaccination rate in Kuwait as well as everywhere, including India, is on the rise.
Right.
The other question generally asked is that you say that for conventional vaccination, you don't take a vaccination if you are sick, if you have fever, if you have a cold. You say, okay, you delay for 1 day. Do you say, can you take COVID-19 vaccination, whether it is with the conventional that we are using here, if you have a sickness at the time on your day of vaccination? For example, somebody has asked me, my patient has got urinary tract infection.
Okay.
Can she wait for urinary tract infection to be treated and cleared before I take the vaccination?
I can think of 3 scenarios then,
Yes.
the one you are asking. Scenario number 1 is, if somebody is having, let us say, mild respiratory symptoms, little cough, little cold, maybe fever, no fever, okay? And then unless he's tested for, COVID-19, and if he's negative, then he may, go into taking the vaccine. Yes. Otherwise, we have to defer the vaccine till we are sure that, he has COVID or not. The second scenario that you asked me about is, now I'm talking about diseases not respiratory, okay, some diseases like, let us say, UT infection. Yeah. The person has mild fever or no fever, but if he's already on antibiotic, this is not a contraindication to take vaccine. He should take the vaccine. Scenario 3, I would say, is, like you mentioned, people may be, and this is for all vaccine, they are moderately ill, they are severely ill, In this situation, they should not take vaccine, wait for the time, till the symptoms are over.
The other question that is asked is, since you have a variety of vaccines, can we interchange vaccines?
This is what we call, mixing and matching.
Yes.
Okay? So you are mixing and matching, the vaccines. No, we should not do that. Yeah. If you are taking Pfizer vaccine, okay, so you should take Pfizer vaccine. Yes. If you are taking AstraZeneca, you should take AstraZeneca. But there may be a situation, when you can mix and match. The situation would be, when, let us say, there is not enough supply of vaccine, then what do? The person has already taken, let us say, Pfizer. Yes. There is no supply, then what do? Then you can, you can take another mRNA vaccine, okay, but not AstraZeneca, because we do not have, any studies to say whether you can exchange one with 2, right?
No,
because
same
Moderna
style
vaccine,
of vaccine,
Moderna vaccine and also, the Pfizer vaccine, they are both mRNA vaccine. Yes. So you can sort of interchange, but that also in a, emergency situation, not otherwise. But the second dose of the vaccine would be the same. It would be taken 1 month after the first dose. No mixing and matching.
We heard about actually in the presentation by the ambassador about the Covaxin development, the indigenously developed Indian vaccine. Are there new vaccines on the horizon?
Well, that I would say, yeah, there is. You know, people are, it is unbelievable that, as of December, there are 250, vaccines in some, stage of trial, 250 vaccine. Out of them, some are oral vaccine, there are intradermal vaccine, but the game changer is going to be the intranasal vaccine. Yes. And I'm very proud to say you asked that question, that India is, in the forefront, to hopefully in the future to produce 2 intranasal vaccines. Yes. And these are going to be produced by the 2 giants, of vaccine maker in India. The first one is, we all know it, the Serum Institute of India. So along, the vaccine that they are, we already, it is mentioned, in our vaccine Maitri program, their Covishield, they are using it to vaccinate the Indian people and also the people outside, yes. Right? So, and the vaccine they are going to produce in the future is called Codivax, and phase 1 trial is already started in England, okay, and with Codigenic. So that's, one thing. And the other one is, the Bharat Biotech.
Yes.
They have, really, we are very proud of, these 2 yes. companies. So, and this they are going to do with Washington University, in USA, and they have already started the phase 1 trial. Now, why we are calling them a game changer? Because see, imagine an intranasal vaccine, right? It is easy to administrate. You just give it locally. This is the site of entry of the virus. There will be a local reaction, and the mucosa, absorbs the medicine first. Yes. And it would be very nice. It's going to be a single dose vaccine. Yes. There is no injection, yes. Right? So you do not need big yes. facilities to store vaccine. Yes. And also, to give vaccine, you don't need big clinics, yes. And so in a situation when you need to vaccinate lot of people yes. quickly, yeah. this vaccine will be very helpful.
I see two points for that. One would be, it would be very useful in a public health campaign, yes. where a lot of people can be given.
And children.
And for example, the way Pulse Polio program is being given to large number of people at one center by administering. Second would be that you are actually trying to produce local immunity at the site where yes. the virus is trying to enter.
And when you produce this local immunity, Dr. Yes. Menon, the thing is, you will not only, get the infection, but yes. you will stop the infection to spread.
Yes, yes.
Yeah.
Thank you. The other question is that this vaccine, can it be co-administered with other vaccine with similar type of diseases? For example, yeah, flu vaccine or pneumovac?
This is the question everybody asks. See, we are very in the habit of, and especially for children, you will know, we take a lot of vaccines, all together on one day. And it saves, time, visits and everything. But we do not have enough data. So what we are suggesting is that not to, take the vaccine at the same time. So if you want to take the vaccine 2 weeks before the vaccine and 2 weeks later, no other vaccine should be taken. Then again, there is an emergency situation. Now, I said, okay, you can't mix the 2 vaccines. But suppose somebody has, let us say, a bad injury, right? So he needs tetanus toxoid. So in that situation, you will not give tetanus toxoid? No, you would give. Really? So you give tetanus toxoid, but this is an emergency situation. Otherwise, you do not, take it with other vaccine. Yes. But here, I would mention one thing also. Even though, the vaccine, the tetanus toxoid is given in between the 2 doses probably, yes. the second dose will be given at the same time as the first dose, at the same time period yes. from the first dose.
The vaccines which are now being administered, we have been following the schedule which they have been prescribed at the time of these vaccines came into the market. Now further studies are showing that many of these vaccines can be given probably at later intervals. So the question is, should we strictly follow the government instructions for dosing intervals as it is?
Yes, I think, we need to follow the manufacturer's, instruction because, to get adequate immunity, for you not to get the infection. Now, let me give you an example. For AstraZeneca, they said, take first dose and then the second dose now they say is after, 3 months.
Yes.
Now for Pfizer, the time interval is 3 weeks.
Yes.
But times are changing again. They have done studies where they found even, for the Pfizer vaccine, after the first dose, after the 3 weeks, there is 90% immunity. So probably in the near future, somebody is going to tell us, give the second dose after 3 months, or maybe it may turn out to be a single dose vaccine, but we don't know yet. But the question which people usually ask is, maybe they are traveling, then what to do? They may not follow the schedule. It is only for the Pfizer vaccine that, you can prepone the vaccine for 3 days before, or the second dose can be given after 6 weeks, maybe meaning that you get a grace period of 2 weeks.
So there are individual instructions
Yes,
in
and
specific situations
Right.
are there. What about older people? What about people with comorbidities like a cardiac condition?
Just now we got
Yes.
this question asked.
Yes.
So elderly.
Elderly.
So they are in the priority list. You see, the Pfizer vaccine, they have studied up to 85 years. So, one of my colleagues only phoned me, her mother is 95 and she was afraid, that to take her for vaccination. But these are priority people. They should get vaccinated. Then the people, the other question is, people who are immunocompromised.
Yes.
And so those people who are immunocompromised, they should also be taking the vaccine.
What about those who are candidates for stem cell transplant, organ transplant?
So
Should they have vaccination?
So I will answer these 2 questions together.
Yes.
Because there is immunosuppression in all. So let me take the question of people with either they are immunocompromised or they are taking immunosuppressive therapy, or those who are taking corticosteroid. So the first question would be corticosteroid. Okay, they can take the vaccine, no problem. But only thing, the immunity in them may be not as robust as other normal people. For the immunocompromised people, again, see, these immunocompromised people, they are at higher risk of getting the infection. If they get infection, it could be fatal to them, right? So they are put in the priority list. And this is not a live vaccine. We are always afraid to give a live vaccine to immunocompromised people because for the danger of these people getting the infection. So it is not a live vaccine. They are more prone to get infection, so they should take the vaccine. The only thing we should be telling them is, that we don't know. The immunity they would be producing would be not that robust, and they have to stick to the 3 pillars we already talked about, the preventive measure, continue doing hand hygiene, continue wearing the mask, and maintain social distancing. Now, people who have, let us say, take vaccine during chemotherapy or when they were taking immunosuppression drugs, okay? See, we said that, maybe the immunity may be a little lower in them.
Yes.
But this is not an indication for us to repeat the series when they become immunocompetent, okay? Yes. And we should not be checking, antibodies in them. Number 1, they are unreliable. Number 2, we don't have an antibody cutoff. We don't know at what antibody level there is protection. So no antibody test. The other question you asked me is about the organ transplant people and the stem cell transplant people. So let me answer the question about organ transplant people first. Again, they are immunocompromised. They are more risk of getting the infection. If they get the infection, again, they could be fatal. Also, I already mentioned that this is not a live vaccine, okay? So even and they are in the priority list in many countries, especially the stem cell transplant people. And they should take the vaccine. The question is, if they have a recent transplant, when should they take the vaccine? So if they had a renal transplant, they can take it after 3 months.
Yes.
If it is any other transplant, they can take it after 1 month. This is for the recent transplant, okay? And now for the stem cell transplant people, John Hopkins, they have done an interim study, and they have studied, people after, transplant for, after 4 years, 5 years, 6 years, like that. And they have found that they can take the vaccine, but again, the immune response, we do not know how good or bad it is. For the stem cell transplant, they say that if you give it after a period of, let us say, 3 to 6 months, maybe the immune response would be adequate.
So it's a little area of introspection which need further studies, but it has to be on a case-to-case basis, depending upon the emergent situation in that particular case.
But again, I would emphasize the same thing what you said before, especially for the organ transplant people. All right, you taken the vaccine, you don't know your immunity status, maintain the 3 pillars of prevention. Yes.
One condition, one normal physiological condition where we are not eager to give vaccination is pregnancy and a mother who is lactating.
Right. So
what about them?
See how the norms change.
Yes.
One time, when the Pfizer vaccine came, they put, pregnancy and lactation as a contraindication, that this vaccine should not be given in a pregnant woman and should not be given in, lactating woman. But now things are changing. Now, pregnant women, as over the months, they have realized that, they have 70% more chances of getting the infection. That's quite high. And also they can have, like stillbirths.
Yeah.
So this is not a good thing to happen. More chances of infection, and in the pregnancy, ending up in stillbirth. So now it is not a recommendation yet, but it's a suggestion. If a pregnant woman, but not counting pregnancy, as a factor, if she falls into a category, where she is in the priority list of getting the vaccination, let me give you an example. A healthcare worker, a frontline worker. Now she is at high risk of getting the infection. So such ladies, pregnant ladies, they should be counseled and told them, about the advantages and disadvantages of the vaccine, that, we have no trial in pregnancy, but these are the advantages to you. You can take the vaccine. But this will be her personal choice. It is not a recommendation yet. And this is being followed in America. I know of 2 of my friends, one is pregnant and the other is lactating. They took the vaccine. And also this is being followed in UK.
There are individual case reports actually of women who are pregnant and lactating, but working in the medical field, taking vaccines. But they are too few incidents.
Because we cannot force them, because there is no data, it has not tried out on pregnant women. So for lactating women is the same thing, it is their choice. See, I read about a study, where they found women who have COVID during pregnancy, the babies have antibodies, and you would understand that even better.
Yes.
So these antibodies, they are protective to the baby.
Yeah.
So, it is like flu vaccine. Why do we give flu vaccine to pregnant women? The idea is to give flu vaccine to the pregnant woman is to protect her and to protect her baby.
Yeah.
So,
the transplacental transfer of the antibodies protect the mother, baby at least for the first 3 months.
This is what they are looking into. So maybe the recommendation will come. Please, vaccinate the pregnant woman to provide, passive immunity to the baby and protect the baby. So we don't know. It will change.
It is not a general recommendation now.
Right.
The question is that I have taken 2 shots of vaccination. I have waited for a month. Am I free? Can I just move freely in the society?
I wish we could all do that. We are all vaccinated here, and I really wish we could do that. But unfortunately, I'm very sorry to say that you can't. Because
why?
Yes, for two reasons. Reason number one is that you can still transmit, the infection, okay? And another, reason number one. The reason number two is that, you can get the infection. So, till, like we said, now this is, again the time for us to tell people to take vaccination. Unless we get herd immunity, and I don't know when that it is going to happen, probably at that time we can think of, not wearing a mask or not, social distancing. But till that time, we stick to our three preventive measures.
So even after vaccination, it is prudent that we follow the standard norms of prophylaxis for COVID-19.
See, Dr. Menon, people say, okay, the same thing. If I'm going to get, infection after vaccine, why should I take vaccine? Yes. But, the norm for vaccination is now changed. Yes. Before we were saying how much protection is there. Now we are not saying how much protection. We are also saying how much illness it will prevent. And what does that mean? That if somebody gets infection, it will be severe. Yes. It will be not moderate. It will be very mild. Yes. And that is the aim.
Yes. Killed vaccine, live attenuated vaccine, mRNA vaccine, spike protein, people are worried. Can it all alter my DNA?
Yes. No, it doesn't. Yeah. See, all, at least the two vaccines that we have here, Oxford, AstraZeneca, is a vector-based vaccine where they are using a vector which is used as an antigen to produce antibody in the body. Yes. So it is no way entering, the nucleus of the cell. Yes. I think the confusion comes from messenger RNA, mRNA vaccine, RNA, DNA, they sound alike. But RNA is RNA, DNA is DNA. So what is messenger RNA? So this is, the poor chap is just doing a job of, a messenger. It takes the message of a genetic code, enters, when it is introduced into the body. So whatever is happening on the surface of the cell, right? The messenger RNA gives this message, okay, I would say like that. It raises the alarm in the, okay, go ahead and produce antibodies. After it has given, the message, it just disintegrates. Yes. It has not entered the cell. It has not entered the nucleus at all. Yes. So it will not, alter the DNA. Yes.
No, can you categorically say that these vaccines are not carcinogenic? They are not malignancy, they have malignancy.
See, DNA vaccines are, people, now we have DNA vaccine and one,
It could come.
Yeah, it will come. And there are a lot of people who are producing this DNA vaccine. Yes. And again, I'm very, India is also producing one. Right. Okay, so, but I didn't mention that before because they are still in the preclinical trials. And but no, nobody can say that. But you see, at the same time, Dr. Menon, we must not forget, when anybody puts the vaccine in the market, or or they license the vaccine, this is after very stringent following. They go through various phases. The preclinical trial, phase 1, phase 2, phase 3. When they find that the vaccine is efficient and it does not have side effect, then only they get the license, and it takes years for this.
Thanks for that clarification, which is at the backyard of everybody's mind when we take a vaccine, about which we don't know much about.
And that is one reason why, at least I know of many, many people, and young people, not taking the vaccine. Oh, it will, one person even went ahead and told me, Dr. Saroj, you can take the vaccine, you have children, you have nothing to worry about. I still got married and I'm going to have children, I'm not taking the vaccine.
Yes. No, we have to clarify these doubts to the general public. The other question is that vaccines are just not for prevention of the disease. There is something called post-exposure prophylaxis for several diseases. For example, rabies, tetanus, several diseases. Like that, it is rampant disease, so can we do something with vaccines for post-exposure prophylaxis?
So let me explain first what post-exposure prophylaxis is. By post-exposure prophylaxis, we mean is if somebody comes in contact, with a disease, like you mentioned, any disease, and they want instant answer to take something so that they don't get the disease. Okay, so this like for let us say you mentioned tetanus. Okay, so you take somebody is wants a prophylaxis against tetanus, or worse is rabies. Bitten by a dog, so they don't want to get rabies, so they say rabies immunoglobulin, so no way to get rabies. But unfortunately for COVID vaccine, this is at a for an individual or even at a community, it will not help. Why it will not help is because the average incubation period of COVID is 4 to 5 days, and it would be, or it can go up to 14 days. So if you give a vaccine, suppose somebody has COVID and you give vaccine, the vaccine is not going to work immediately, right? So you need 2 doses also. So it will not provide protection. So it is
at the moment, current vaccine do not provide
Yeah.
any protection from that. It's a lot of questions on vaccines. Still, questions are pouring into my mobile. But there are a lot of questions now coming about heart-related illnesses. We have in our audience Dr. Hassan Ali Khan, who is a practicing cardiologist, senior cardiologist working at Exir Medical Center. Dr. Hassan Ali Khan, the questions I will just summarize into one. What are the common heart-related conditions that we should take care to avoid damage, further worsening during COVID-19? And are there any contraindication to vaccination in patients with existing heart diseases?
Good evening, and thank you for inviting me here, Dr. Menon. The way I would answer this is that if you start with the simplest illness which is related to the heart, hypertension itself. Hypertension, again, along with diabetes, these are the high prone cases where the infection might lead to severe form. Other than that, there are groups where one has to be careful, which we have already mentioned. People who are already having a heart disease, and then they have a sort of a situation where they are immunocompromised, they are more likely to get the things. Then you have situations like cardiomyopathy, where you have a dilated heart. They have to be more cautious. We have conditions, for example, there is a condition where arrhythmias, by arrhythmias I mean there is a condition, for example, I'll explain it, Burgada syndrome we call it. In Burgada syndrome, there is a likelihood that your heart rate might suddenly go up, and you might have detrimental effects. These are the people, again, they have to be extra cautious. Atrial fibrillation, for example. Per se, atrial fibrillation is not really directly related, but again, these are the people where you need to be cautious about. The other situation is, for example, you asked me about vaccine. As far as my knowledge goes, and we have spoken extensively about vaccines, I don't think any condition is there which would contraindicate the taking of a vaccine. Rather, one should encourage these patients who are having any of these related heart conditions to go ahead and take the vaccine.
Yes. Thank you, Dr. Hassan, for clarifying this question, which is being, quite a number of questions are coming in from the audience actually about postponing vaccination because of an existing cardiac illness. Thank you. Another set of questions that are coming is addressed to my colleague from surgery. We have Dr. Vinod Grover, who is a consultant surgeon working at Al Jahra Hospital, General Hospital. There are two questions, Dr. Vinod. How safe is surgery during COVID-19 pandemic? Currently, the Ministry of Health is actually postponing all surgeries, essentially to provide more space and facilities for managing COVID-19 patients. But it creates a little bit of fear psychosis that can I do surgery when this pandemic is going on?
Thank you, Dr. Menon. I will ask this question I'll reply in two parts. The patients having COVID disease and operated or have within 7 days to 30 days after operation, they have a high risk of complications and death rate. And the complications are about 15 to 50% quoted in the studies.
Yes.
And the main complications are lung complications like pneumonia, respiratory failure, needing ventilator, ECMO, kidney failure, infection, septicemia, even stroke. And about 15 to 30% of these patients need ICU care. And these complications are more if the patient are obese and more than 70 years of age, having comorbid diseases like hypertension, diabetes, ischemic heart disease. Major surgeries are done, surgery done in emergencies, then their complications are much more. So with these complications are more, and even the death rates have been quoted between 66 to 20% of the patients having COVID. In fact, if emergency surgery is done, it can go up to 29%. As regard the non-urgent surgery cases, or like we call elective surgery cases, these cases, every hospital and every country has different setup because depending on the number of COVID cases. But by and large, they are either increased, the surgeries are decreased or postponed in view of that taking care of the patient's health, prevent the spread of the disease, and to save the resources, which include like PPE kit, ICU beds, ventilators, or the medical personnel, including doctors, nurses, and technicians. If the COVID cases go up, these personnel are mobilized to the COVID ward and COVID ICUs. So that time we have to take care of so the number of elective surgery, non-urgent cases goes up and down depending on the number of the cases in the country. Then this main thing that these patients who need non-urgent surgery, they should have a counseling with the surgeon, proper discussion with the surgeon who's going to operate. Depending on the disease, whether we can postpone this without any risk factor of that, or by the time they get their turn to get operated, is there any alternative medicine, like piles, you can give some medical treatment, some medicine. Then delay the surgery for 4 months, 6 months, all that you can do. So this case have to be discussed with the patient and then take the decision.
Yeah.
Thank you.
I think we need to explain the situation to the patient and probably the health situation. We will, under the existing health situation, emergency, probably we will take an appropriate decision. I hope my colleague Dr. Rohit is second arm to a surgeon. You also agree with this plan of action?
Yeah, right now actually in Kuwait, there is a new circular regarding closing all the elective surgeries in all hospitals except 4 centers.
Yes.
So even my hospital is closed. So
Mine too.
So we will be either redirected to the COVID ICUs again.
Yes. So
depending on the number of cases.
We are allotting more space and facilities for the management of the COVID-19 situations. The other question that is asked is that I had COVID. I have to have a surgery. When I can have a surgery after having a COVID-19 infection?
Well, it depends on the disease process. If somebody is asymptomatic or very mild symptom, he can have surgery after 4 weeks of recovery.
Yes.
Somebody having some mild symptoms but not needing hospitalization, slight dyspnea, maybe tachypnea, but not needing hospitalization, can have surgery after 6 weeks.
Yes.
Patient having more respiratory symptoms needing hospitalization about 8 to 10 weeks, and the person who had needed ICU admissions at least 3 months should be there.
So it depends upon the indication and the surgery plan. The plan will change.
Yeah, severity of the disease.
Yeah. Thanks for explaining so succinctly. A lot of questions are also related to malignancy and related problems because they are highly immunocompromised. They are malignant conditions itself are susceptible to any infectious disease. added on to that, the treatment that they receive, the medical treatment, the radiation treatment, the need for surgery, all make them more prone to more serious consequences of COVID-19. We have in our audience Dr. Sushovana Sujit Nair, who is a medical oncologist working with the Kuwait Cancer Center. Dr. Sushovana, can you please explain to us what are the special precautions and that we have to take while managing patients with malignancy and COVID-19 disease?
Good evening, sir, and good evening, everybody here. First of all, thank you so much for having me in this session today. Yes, COVID-19 for cancer patients and we oncologists, it's really a challenge, even today. In the beginning, we had no idea what are we going to do with our patients. Basically, for cancer patients, as we all know, sir, we stratify them into two classes, curable disease or palliative disease. That means early disease or later stage disease. In curative disease, where we know that we can cure the patient of a disease like cancer, surely we have to be very aggressive. So in those cases, generally the treatment is aggressive with aggressive chemotherapy, which may also involve surgery and radiation therapy to give a complete cure to the patient from cancer. So for those cases, we have again cases like locally advanced or locally non-advanced, means early. So if locally advanced, generally those patients, say suppose breast cancer or bone cancer, lung cancer, locally advanced but not metastatic, stage 2 or stage 3. We medical oncologists put them on chemotherapy, which we call neoadjuvant chemotherapy, that is to help the surgeons by reducing the tumor size, by downstaging the tumor, so that the surgical intervention will be better to have a better outcome after the surgery. So what we found in the initial days, that our chemotherapies were making patients more prone to getting cancer, getting COVID-19. Because during chemotherapy, as we know, the immunity comes down. We put them on growth factors. So what we did was, we were postponing chemotherapy and we were putting the patients on hormonal treatment, those who were hormonal positive. But again, some patients who were not hormonal positive, like triple negative patients who need only chemotherapy, for those patients, we had to do risk stratification, like the risk of getting COVID is more, or the dying from cancer or aggressiveness of or progression of the disease is more. So in that case, if we found that the patient is young and patient has a good immunity, can tolerate the chemotherapy and may not develop the COVID, so we kept them in isolation and we continued with the chemotherapy. Now, as we all know, sir, that metastatic disease, that is patients when there is stage 4, the disease is systemic. In that condition, cancer as well as the treatment both increase coagulability of the blood. As in the beginning, Dr. Kurian also said that COVID is also known to or notorious for increasing thromboembolic phenomena. So in our cancer patients also, because chemotherapy plus this metastatic disease, both of them can increase the coagulability of the blood. Patient can go in for more of pulmonary embolism or even strokes. So for those patients, generally we postpone chemo, because in metastatic disease, our treatment outcome is not going to be curative, it is only palliative. So once we know that we are not able to make the patient cured from the cancer, so then why to give a risk of developing COVID, which may become very serious in such patients. Among all the diseases, cancer is the most vulnerable for getting such infections, and our patients are the most risky group to get those infections and becoming very serious. So presently we have learned much after all this 1 year of COVID scenario, and we cannot generalize our cases. Each case of each cancer patient is a unique case. So again, generally in our hospital also, we do have something like multidisciplinary meetings where we do discuss the risks of COVID versus the treatment or the cancer risk, the disease progression risk, and each case is dealt with accordingly. Young patient who can tolerate the treatment and the risk of getting COVID is less, generally they proceed with the treatment as usual. And elderly population or those with metastatic burden, heavily burdened metastatic disease, we generally postpone till a better date.
Thank you for clarifying that. It is a decision which has to be made by a team of specialists working together.
Yes.
Here probably the importance of having a multidisciplinary team taking decisions on appropriate management. Thank you, Dr. Sushona, for clarifying.
Thank you, sir.
We have heard about a lot of symptoms which are peculiar to COVID-19. One was the inability to appreciate smell, anosmia, inability to feel the taste. But one thing which was probably not described earlier, but which came much later, is development of rashes on the skin. Are skin rashes common, like all other symptoms that we commonly see? We have to answer this question. We have in the audience Dr. Arun Joshi, who is consultant dermatologist at the Al Farwania General Hospital. Dr. Joshi, can you please explain if this could be a good marker for early and easy diagnosis of COVID-19?
Sir, first of all,
Mic not on.
hello, yes. Sir, first of all, I thank Embassy of India and IDF to making me a part of this very illuminating and very informative, comprehensive symposium on COVID on all its aspects from A to Z with the current information. And it's my honor and privilege to be sharing with this symposium with my teacher and guru from my MBBS days since 1984 from AIMS. Sir, I would like to ask a reply by this question, that skin manifestations were late to be recognized and understood as part of manifestation of COVID infections. In fact, the first report came in March 2020. And still the exact figure, how many people get skin rashes, is not known. In fact, the first report which came from Wuhan, they mentioned only 0.2% of the patients had skin rashes. Later on, from Italy and Spain, when there was disease exploded there, 20, 40%, 50% of patients. But what we have to know is that these were patients who were being admitted, seriously sick patients. The doctors had time to started looking at the skin manifestations. Okay, the patient has skin manifestations also. And many viruses cause rashes. Some of them are very specific, like chickenpox, anybody can recognize. So then the doctor started recognizing, okay, like whether the skin manifestation these COVID patients are having, whether they can be helpful in making a diagnosis, hinting the person is having a COVID, or prognosis. The problem with COVID has been that it has been a very unusual virus, and that probably is an understatement of the year. Like this virus has affecting almost all the organ systems of the body, and the kind of skin rashes, more than 20 skin conditions have been found associated with skin as a skin manifestation of COVID-19. Fortunately, dermatologists, specialists, and the national associations have started documenting and classifying and recognizing them, whether they make any sense. So 6 patterns of skin manifestations have been found more commonly. But exact figures is still not known. That do all patients of COVID, whether they are asymptomatic or mildly symptomatic or more moderately symptomatic or severely symptomatic, do they all of them get skin rash at some stage is not known. So roughly it is mentioned that 20% of the patients will have some kind of skin rash. Now whether, and another peculiar thing is, it's not one kind of skin rash, which when, like suppose somebody has chickenpox, we say, okay, this is chickenpox, it is caused by that particular virus, or herpes, or molluscum. Since COVID-19 is causing more than 20 kinds of skin manifestations, to say anybody coming, and some of them are very common condition like urticaria, patient getting hives or wheals, or patient getting some vesicles on the trunk, which can be like chicken pox, or a generalized maculopapular rash, which is seen in many common other ordinary viruses. Very peculiar thing about COVID-19 SARS-CoV-2 virus is that it is a younger brother of SARS-CoV-1, which caused MERS. In those patients, less than 2% had skin manifestations. In COVID-19, almost 20% is expected to have some manifestation. And what is the relevance of these skin manifestations? Some have been seen during the asymptomatic stage or the prodromal stage, when the person is not even sure whether he had symptoms of some like COVID-19 toes, COVID toes, like blue discoloration or acral cyanosis happening on the toes, which appeared very dramatic, but it is found to be appearing in the later stage, when the person has already recovered from COVID. So it's very tough to say. We are still documenting, classifying, but yes, some conditions have been found in younger group of patients. Urticaria is found as a prodrome, but maculopapular rashes during when the other symptoms start appearing like cough or fever, COVID-19 toes or COVID toes, later stage. And the dermatologists or skin specialists have started to classify them whether a person has this manifestation, whether it correlates with the severity of the COVID the person is having. So in that they have found like the people who get purpuric or necrotic kind of manifestation, rash, where there is a bluish discoloration or bleeding into the skin and breakdown of the skin. Those are the ones which have poor prognosis, but these manifestations seen in very, very less number of patients. Although skin being the largest organ, it provides a very good and visual. If it can give an indicator that this rash is, like typhoid also condition used to have a rash, but somehow there are too many manifestations to correlate it. We are still trying to refine the criteria, yes.
All are witnessing, if we follow the trend of reported cases, and I am very closely following, most of the pandemic, we see that there is a bell-shaped curve, in the pandemic. And we find that in Kuwait, the COVID-19 cases were at maximum reported in the initial phase like June, July, and August. And then there was a gradual downward trend. But unfortunately, from 8th January, pinpointing exactly onwards, there is a surge of the cases. And this reinforced the fact, and we know that the Ministry of Health, in consultation with the Council of Ministers in Kuwait, has taken some decision like canceling all flights or like banning the entry of expatriates, not to have gatherings during this Eid celebration and holidays. These are all taken carefully to ensure that there is no further spike of the cases, because more number of cases, more number of vulnerable patients, more hospitalization and burden on the healthcare system. Unfortunately, still the numbers of cases are like more than 750,000. Average cases are reported in last 6 weeks is approximately like 900 to 1,000. So this again reinforces that we should be very cautious. We should follow all the social norms which has been mentioned so well in last 1 year, and we have mentioned it in couple of times, till the vaccination, which is now going to have a comprehensive vaccination drive both in Kuwait and also in India, because many of the passengers which are returning from our country, they also need to be vaccinated so that there is no individual who is susceptible. Final objective is to develop something called as an herd immunity, and this is only possible when approximately 75% of the population has already received the vaccine. And then possibly we would be able to do what Dr. Saroj has mentioned very categorically, taming the virus. The virus is not going to go away. Once the human-to-human transmission is there, this virus will be there. But if we have sufficient immunity inside our body, we will not be suffering from the severe complication or devastating impact of this disease.
Thank you. Dr. Rohit, would you like to add to this?
I just want to highlight here that the number of cases, for example, just giving a statistics, Al-Razi ICU is covering the Sabah area, and at a time when there were cases where number of 17 to 20, December end they reached number of cases to 0. We were joking with them as to what are you doing. The Al-Razi ICU has increased cases to 19 last I know. Jabr, which had 8 ICUs, came down to 2. Now they are opening the 5th ICU again. So Mishrif, my close colleague who's heading Mishrif, also the cases are increasing. So number of cases coming per day can be depending on number of testing done or whatever. But for me, the most important is how much is the increase in number of ICU cases, which is actually in the rise right now. So personally, even I have started taking precautions, not going out as much as I was before when the cases were reducing.
Dr. Manu, you are actually really in the front line of this sudden, unexpected, rapid rise.
Yes, sir. Actually, like Dr. Rohit said, we had come down to our ICUs of 2, and even our wards, we had shut down many, and we were at a very good stage. And then, like Dr. Ajit said, now from Jan 8, once the numbers have raised, yes, even in our hospital, the numbers of wards and the ICUs are rising as such. So I think this is the time when, everybody should understand the importance of taking the vaccination and how important it is to protect not just ourselves, even the ones around us. And this peak, like we were discussing here, there is a peak and then it comes down. So it is nothing to worry. It's the 3 pillars that we always have been told for last 1 year to follow. We just have to follow that, get ourselves vaccinated, make ourselves more healthy, and that should protect us a lot.
Thank you, Dr. Manu. I think we are now going into a stage where we will have probably peaceful coexistence with a tamed virus. So the last question of the day to you, Dr. Saroj, the lady of the panel, how does the vaccine is going to change the pandemic scenario for the future?
Yes, so that's a little difficult question to answer because we don't know so much about vaccine. We know that the virus is new. We know that the vaccines are new. But on the positive note, I would say that, now we got the vaccine in a record time. It's like a fast forward, that it should change the future. Now, how long does it take? We don't know. It will probably take a long time. Like, when we answered your question about post-exposure prophylaxis, it is not like a light switch that you put it off, you take the vaccination, and the virus is going to disappear. It is not going to disappear. It is going to stay with us for a long period of time. We will continue doing what we have been talking about, the 3 pillars. But having said that, we are optimistic as well. Yes. That a time will come.
We must be.
Maybe, yes, we should be. That maybe it will take a little longer time. We will have herd immunity, But then yesterday only I read one article that herd immunity we are not going to get the herd immunity fast. We keep on saying herd immunity, oh, it is like it is round the corner. It's not round the corner. It will take time, but eventually it will come. Also on the positive note is that, now we are talking about maybe 2 or 3 vaccines, which the world is using it. But like I said, there are about 250 vaccines that I know of, which the world is producing. Soon we will have lot of vaccine. Soon we will have different type of vaccines. And then probably we'll be able to, vaccinate the world in a faster manner. And maybe we will end the pandemic. And the sentence which I used in the beginning, vaccination is the beginning of the pandemic, and hopefully we will end the pandemic.
It's a question of finally taming the virus, but this virus also is highly intelligent, is able to change its color. So we have to be extremely careful how we conduct ourselves. I think we have to have some sort of socio-cultural, behavioral change. We have all been discussing about the medical and the psychosocial aspects, but there are several other aspects of this disease which has got implications on socio-cultural, behavioral, as well as economic aspects. It is too difficult for an expert medical panel to answer all these questions. But we cannot keep on going forever. I think every good session has to come to an end. I would like to end the session by thanking, first of all, my esteemed panelists who bore with me with my troubled questions and interactions at all times of the day and night, but managed to come and be here despite their duties and other things, and also for precise answers. My special thanks are to my invited colleagues from the Indian Doctors Forum who made their presence here despite their busy schedule and answered very beautifully things. I have learned a lot. I hope you also have learned a lot. But we are still learning. There are so many still unanswered questions. We will learn as we go along. We will learn and probably we will learn how to control the disease and provide probably a better future for our children, younger colleagues, and those to come. Till that time, let us probably stick to the 3 pillars of the management of any pandemic. 3 pillars are safe hygiene, which includes hand hygiene, wearing mask because this is a disease spread by aerosols and by air, and also by socially distancing. Let us continue to harness these 3 major aspects of any pandemic management rather than thinking of high-intensive, highly technological managements. That will definitely come in the way we are working. Let us strive hard for that. Let me end by thanking, number 1, the Indian Embassy for giving us all this opportunity to share our thoughts and our knowledge to all of you. And my special thanks to Dr. Amir Ahmed and the team of office bearers of Indian Doctors Forum who had trust in us to conduct this particular session. I would like to make one disclaimer. We are not the final experts on the disease, on COVID, or any specific management. We are also learning, students even at this age, learning from our experience. We instruct, we advise everybody to follow the national health guidelines because these health lines are in the interest of the overall good of the population. So please follow all guidelines on management, social distancing, vaccination, and follow them to the utmost in your practice and your profession. Thank you. I would like to thank all of you on behalf of the panel. Thank you once again.
Thank you so much, Dr. Menon, Dr. Grover, Dr. Rohani, Dr. Chattopadhyay, and Dr. Manu for your time and participation. We are grateful to you for providing us the most authentic information and comprehensive information on various aspects of COVID-19 management. It was great to hear straight from horse's mouth today. Thank you once again. With this, we come to the end of today's program. Thank you everyone, especially those who join us virtually. Thank you, Ambassador C.B. Joss, sir, for your guidance and encouragement. A big thank you to Dr. Ahmed Tuweni Al-Anezi, President of KMA, for his address. Many thanks to the Indian Doctors Forum and the Indian Associations in Kuwait. Thank you, Team Embassy of India, Kuwait, all the media persons. Thank you, one and all. Good night.